So now I'd like to turn the program over I will be introducing several different individuals who are involved in the fight against TB. First, we have Traci Hadley, who's the state TB program nurse from the Missouri Department of Health and Senior Services. She works tirelessly with our local public health agencies and healthcare practitioners across the state to protect Missourians from TB. And she's going to talk about TB from a global, national, and state perspective. So, Traci, please step up. Thanks.
Good morning. I'm happy to be here on World TB Day and to play a part in bringing about awareness to a disease that many have thought only occurs in other countries. This disease is known as tuberculosis. I would like to begin by saying that TB is one of the world's deadliest diseases. According to the Centers for Disease Control and Prevention, 1/3 of the world's population is infected with TB. Each year, over 9 million people around the world become sick with TB, and almost 2 million people die. This translates into one person dying every 10 seconds. TB is the leading killer of those individuals who are infected with HIV. In 2009, in the United States, there were 11,540 TB cases reported. In the same year in Missouri alone, there were 3,393 reported cases of individuals that were infected with TB and 80 cases that were diagnosed with active TB disease, most occurring in St. Louis and Kansas City. However, in 2009, in Cole and Boone County combined, there were 286 cases of latent TB infection and 3 cases of active TB disease reported. Since 2005, there have been 39 deaths due to TB disease in Missouri. Now that I've made you aware of the statistics, I would like to discuss tuberculosis. TB is caused by a bacteria that usually attacks the lungs, but it can attack other parts of the body as well, such as the kidneys, spine, ears, eyes, and brain. TB is spread into the air from one person to another. The bacteria are spread when a person with TB disease coughs, sneezes, laughs, speaks, or sings. People that are close by breathe in the bacteria and become infected. Most people that breathe in the bacteria have a healthy immune system and they can fight the bacteria, stopping it from growing. When this occurs, the bacteria are not active and they cannot cause disease. Therefore, the person does not have any symptoms and is not contagious to others. However, TB can live in your body without making you sick. This is called latent TB infection, or LTBI. However, if an individual becomes infected with the TB bacteria and their immune system cannot stop the bacteria from growing, this is called TB disease. This individual is having symptoms such as fever, chills, weight loss, weakness, night sweats, and a prolonged cough. They are able to spread the bacteria into the air, causing them to be contagious to others. Some people can develop disease within weeks of becoming infected with TB. Others may become ill years later when their immune system becomes weak and they are unable to fight the bacteria, allowing it to grow and cause TB disease. The good news is there is treatment for TB disease. However, if it is not treated properly, TB disease can be fatal. Over the last several years, there have been new forms of TB disease that have been discovered, one of which is multi-drug resistant TB, also known as MDR. MDR is caused when an individual is infected with TB bacteria that are resistant to 2 of the primary TB medications. The World Health Organization estimated that 440,000 people worldwide had MDR in 2008, and 1/3 of them died. The numbers for MDR TB are only estimates because many cases remain undiagnosed. There is also XDR, extremely drug-resistant TB. It was first reported in 2006. This type of TB is even more difficult to treat, and the treatment can be very costly. XDR is resistant to most of the TB medications. No good numbers are available for the incidence of XDR TB, but the World Health Organization estimates that there were 25,000 cases worldwide in 2008, and nearly all its victims died. When an individual is being treated for TB disease, this is quite costly to society fiscally and to the individuals themselves. A person with TB disease is required to be isolated for a period of time, causing them to be unable to socialize or go to work, causing a strain on relationships, possible job loss, a loss of income, as well as a sense of fear from other individuals. What I would like to leave you with today is TB elimination. Together we can. We need to start by treating individuals that have latent TB infection before they are having symptoms and able to spread the disease. And we need to educate ourselves and cause awareness to others so that this disease can be eliminated from the world. Thank you.